We are going to begin. We have two bills that we're going to hear, and we have two bills in which we're going to take final action. A weatherman told me that we are expecting lots of snow tomorrow. And so would you like to speak up about that, Mr. Weatherman?
Well, I was just looking at the new models before I came in at 5 a.m., Madam Chair, and it's looking a little less concentrated, maybe more like 5 to 7 inches. But yeah, walk in the park. But the new model runs are coming in right now, and I was just telling the majority leader here that I'll know a little bit more by later this morning. But it's still a significant snow. So there you go.
Thank you, Senator Weatherman, that we count on so much. So I do want to discuss with you kind of today's agenda and how we're going to divide it up. So we'll give 2 minutes for our conferees. Because it looks like there's a high chance we will be virtual tomorrow. I talked with the IT department this morning. We can do everything virtually for those that are listening that we're going to be here tomorrow. We're set to do that Wednesday and Thursday, depending on how the weather looks. So we're trying to play it by ear. However, the way our rules read in the Senate, there can be no voting virtually. So it would be hearing of bills only and no final action, which hopefully when we come back on Friday, it'll be packed with final action on Friday and Monday. So just to give you the committee and the people that are listening a heads up. So we're going to begin with Senate Bill 82, and if you could give us a brief, please, Jenna.
Thank you, Madam Chair. Good morning, committee. Senate Bill 82 is a nice short one-page bill. It requires the Secretary for Aging and Disability Service to grant a physical environment waiver for existing nursing facilities, so that's one term, who are applying for a rural emergency hospital to transition up to 10 swing beds into skilled nursing facility beds. So if a rural emergency hospital has these 10 swing beds and they want to transition them to skilled nursing facility beds under current rules and regulations, because they have that new designation, they would have to meet all of the physical environment requirements for a nursing home. And so this would be them applying for that waiver. This will require the Secretary to grant that waiver to that rural emergency hospital if that facility is currently licensed as a rural emergency hospital. If they were licensed as a hospital immediately prior to being designated as a rural emergency hospital, and while licensed as a hospital, the facility provided skilled nursing facilities or critical access hospital swing bed services for at least 1 year without a finding of immediate jeopardy. And this bill will go into effect on July 1st. I'll be happy to answer questions.
Committee, are there any questions for Jenna this morning? Seeing none. Thank you so much, Jenna. We will move to our proponent oral testimony. We'll begin with Tara Mays. Tara, welcome to committee.
Good morning, Madam Chair and members of the committee. I am Tara Mays with the Kansas Hospital Association. Appreciate the opportunity to appear before you this morning to support Senate Bill 82. As you all may remember, I'm just going to go through kind of some of the background on this, and then I will let the next conferees talk about the specifics of the situation. But our rural emergency hospital statute went in place in 2021. It allows a hospital essentially to get rid of their inpatient beds, but keep their emergency room, and allows them some flexibility to be able to select other services that their community may need. Many of our rural emergency hospitals, or those that will transition in the future potentially to rural emergency hospitals, have what is called skilled nursing facility beds. They also can be called swing beds, but we are moving them to skilled nursing facility beds. What those beds actually functionally do is provide a core service to the community. It allows someone who has perhaps had some sort of procedure in a higher acuity setting to be able to recover closer to home. So these are short-term stays, so they really don't have a place to be in a long-term care setting, but it allows them to do some short-term recovery. They are close to home and close to family. This is very important for those that might be looking for rural emergency hospitals, but also those hospitals that, deal with bed space issues and want those patients to be able to go back and be closer to home while they're recovering. So this bill, we had always anticipated that that when a rural emergency hospital transitioned, that they would be able to have these beds licensed under KDHE, as they always have. But the agencies had talked about it and decided that actually these skilled nursing facility beds need to be licensed under KDADS. And so what you see here is a remedy to a situation that not only impacts our first rural emergency hospital that has ran into this, but all of the potential rural emergency hospitals that could look to transition and keep skilled nursing facility beds in the future. And so this allows those hospitals to be able to keep those skilled nursing facility services without having to make infrastructure upgrades as if they are a brand new long-term care facility. So with that, I'm happy to stand for questions, Madam Chair.
Perfect timing. And secondly, next we have Kylie Childs. Welcome.
Good morning, Madam Chair and members of the committee. My name is Kylie Childs. I'm the Director of Government Affairs with Leading Age Kansas, which is the state trade association of nonprofit and other mission-driven aging services providers. So we'll let Erin talk to you a little bit more about Mercy Hospital's experience, but really what we wanted to come in and share is we've been working with you all a lot over the last few years due to the number of closures of beds that we've seen in the state. And we feel that without doing this remedy, we could lose even more skilled nursing beds, and it would worsen our capacity and our access to care for seniors. So we do feel that this is something that KDADS would be able to provide through a physical environment waiver, which is granted already to current adult care homes who have been working and providing these same types of services in the adult care home setting in their buildings for a while now. It's just that with these hospitals, they've always been licensed under KDHE, so KDADS does not feel they are able to grant that waiver without some guidance from the legislature in saying that they're able to do so. So we are supportive of this in moving forward, and we'd ask you to support Senate Bill 82. I'm happy to stand for questions at the appropriate time.
Thank you, Kylie. And we have a virtual proponent testimony from Mercy Hospital, Erin Herbal.
Yes, good morning, Madam Chair and members of the committee. My name is Erin Herbal. I am the administrator and CFO of Mercy Hospital in Mound Ridge, Kansas. We are one of the rural emergency hospitals in the state, and we have very much appreciated the state agencies working with us as we made that transition. Unfortunately, we did run into the difficulties that have just been described regarding our physical plant, which had been able to receive satisfactory surveys and would have been grandfathered if we would have continued as a swing bed hospital. But now that we're entering this new designation and would be now surveyed under a different state agency, being KDADS, we were looking at remodel costs that would have been probably close to $3 million to bring our facility into compliance with the conditions that would be expected of us as a brand new nursing home. So we're dealing with a concrete block structure that is very expensive to remodel. And as a facility that's provided skilled nursing services for over 50 years with no patient complaints and no immediate jeopardy citations during that time, we feel like it is very reasonable to grant a waiver to the physical environment expectations in these situations as the bill dictates, where the facility was already providing those services and there has been no citations. Very much in support of the language that's been included in Senate Bill 82. And it would be a great benefit to our community to be able to have skilled nursing facility services again, and also to other facilities in the state. I appreciate the opportunity to provide testimony, and I will stand for questions at the appropriate time.
Thank you, Erin. And before we go to the neutral testimony committee, are there questions of the proponents? Senator Owens.
Thank you, Mr. Chairman and Madam Chairwoman, excuse me. And I just want a special shout out to Erin. Erin Herbal runs Mound Ridge Mercy Hospital and is in my former House district, unfortunately not in my Senate district, but I just wanted to tell him that I appreciate the work that he is doing, especially within the community, to ensure they make the moves to save that very important hospital. So thank you.
Senator Petty.
Thank you, Madam Chair. And this is a question for Tara. Tara, so just so I understand this, they're now, if they're under KDADS, they're referred to skilled nursing instead of swing beds. Is that
That is the switch. Technically speaking, they're moving from swing beds to skilled nursing facility beds, but the services are really pretty much the same.
Okay, thanks.
Additional questions, committee? Seeing none, we will move to neutral testimony. Lacey Hunter. Welcome to committee.
Good morning, Madam Chair, members of the committee. My name is Lacey Hunter. I am the Commissioner of Survey Certification and Credentialing for the Kansas Department of Aging and Disability Services. Thank you for the opportunity to provide testimony on Senate Bill 82. Senate Bill 82 adds a section to the Rural Emergency Hospital Act that would require the Secretary of the Kansas Department of Aging and Disability Services to provide a waiver to physical environment standards to any rural emergency hospitals that meet criteria described in the bill, allowing them to transition up to 10 beds from swing beds to skilled nursing facility beds. To receive the waiver to physical environment standards, eligible hospitals must be registered rural emergency hospitals and have been registered hospitals before being rural emergency hospitals. Eligible hospitals also must have previously provided skilled nursing level care or identified swing beds. Senate Bill 82 would have little physical impact on KDADs and solidifies into statute KDAD's authority and responsibility to provide waivers to statute or regulatory requirements, which had previously been unclear in legislation. KDADS is aware of only one rural emergency hospital that meets the criteria to request a physical environment waiver. Senate Bill 82 would have no impact on providers unless the Center for Medicare and Medicaid Services, or CMS, allows for this newly created entity to be certified under Title 18 and Title 19 services. KDADS did not have regulatory oversight of the facility that would qualify for the waiver under Senate Bill 82 and does not have information on the utilization of long-term care beds in the facility prior to its transition to rural emergency hospital. Granting the waiver from the physical environment standards for a facility that meets the requirements of Senate Bill 82 could allow the provider to continue providing long-term care services as it did before the transition from a critical access hospital to a rural emergency hospital. Thank you for your opportunity to provide testimony. I'll stand for questions when appropriate.
Committee questions? Yes, Senator Clifford.
Thank you, Madam Chair. Just to clarify your remarks, I'm reading along and you said if CMS allows, but in your written it says does not allow. So just clarify.
I do need to clarify in my testimony because what our testimony should read is that if CMS allows for this newly declared entity to be allowed to be certified under what is called long-term care services, as they were previously, their swing beds were certified under what's called acute and continuing care services by the Center of Medicare and Medicaid Services.
Thank you, Lacey. Thank you, Madam Chair.
Senator Petty.
Lacey, so am I understanding that there are some restrictions here? I mean, it has to already have been rural hospital designation. They already had to have these beds in place. So as I'm reading along here, it appears there's only one entity that this fits. Is this correct?
To my knowledge, and when we conferred with our partners over at KDHE, and I'll look back to make sure, but to our knowledge, yes, there's only one hospital that would meet the requirements of this waiver, and there's only one rural emergency hospital, or there are no additional rural emergency hospital applications that the Department of Health and Environment is currently reviewing or looking at.
Thank you.
Additional questions? Senator Thompson.
Thanks, Lacey. I know it takes time to get these waivers. How long do you anticipate if this bill passes and we submit it? Should it be fairly quick or?
Yes. So as previous conferees had said, so what this legislation is going to do is basically give our agency the direction to provide waivers to settings that were previously licensed as hospitals.
Okay. Thank you, Madam Chair.
By the way, I want to welcome Danola. Some of you remember her as being our amazing committee assistant previously, and then she decided she would just go part-time. But Suzanne has been out quite ill, and so Danola has stepped in, and gosh, do we appreciate that. So yay, Danola. Any additional questions, committee? Seeing none, thank you so much. This closes the hearing on Senate Bill 82, and we will open the hearing on Senate Bill 88 and begin with a review or a brief from the reviser.
Thank you, Madam Chair, members of the committee. Senate Bill 88 would require the state long-term care ombudsman and regional ombudsman to receive training in memory care. This bill is one section. It amends KSA 75-7306, and that's the statute that sets out the powers and duties of the state long-term care ombudsman. It amends subsection F by adding to the training that the long-term care ombudsman is required to prescribe and provide. It adds This bill adds required training on the rights and needs of long-term care residents who have dementia and strategies to care for these individuals. And that training shall include, but is not limited to, understanding the warning signs of dementia, knowledge of person-centered dementia care, effective communication with such residents, recognizing behavioral symptoms and alternatives to restraints, addressing specific threats to resident safety, including wandering, referring resident support systems to accurate and update information, and protocols for connecting individuals living with Alzheimer's and other dementia to local care resources and skilled dementia care professionals to encourage cross-referral and reporting incidents of abuse. And it would go into effect on July 1st. I'll be happy to answer questions.
Questions for Jenna Committee? Seeing none, we will move to our proponent oral testimony. We'll begin with Haley Ordone. So Haley, I see you so many times and I always say it wrong. Correct me, please.
Good morning, Madam Chair. You actually got it right the first time. It is Ordone.
Ordone, okay.
That's okay. I'm very used to it. All right. Good morning, Madam Chair, members of the committee. Thank you for the opportunity to be here. I am the state long-term care ombudsman, so I do represent exactly who would be impacted with this bill. And I first want to start off by just a mini education of exactly what is an ombudsman, because most people don't even understand that and the role, and sometimes it kind of clouds how this is going to apply. So first, the state long-term care ombudsman, it's a federal allowed program through the Older Americans Act. So that is where a lot of our oversight comes from. But we're resident-directed advocates. So what that means is we ensure that resident rights are being followed for the resident. We take our direction per the resident. We ensure that the civil and human rights and the overall well-being of the people who reside in the adult care home are being followed. We give a voice to those who might otherwise go unheard. And we also come into that adult care home setting. We investigate on behalf of them. We resolve complaints. We educate the residents, facility staff, families, community in general. We advocate for policy changes that affect those individuals. And we regularly conduct visits just to be accessible and investigate their complaints and try to work to resolve them. So that is the point of our office. What we are not providers of direct care. And I want to clarify that. For example, we cannot even push a resident in a wheelchair down a hallway if they need assistance. Like, we do not provide any sort of care. So I want to come in and clarify. We do support dementia training. We do support education for our office, and we already do provide that. I did want to reference, because I know 2 minutes can go very quickly. In my testimony, I did provide some additional packeted information. Okay.
We're going to go ahead to the other, give everybody their 2 minutes, but I'm sure we'll come back to you with questions. Okay. Jamie Gideon.
Thank you, Madam Chair Gossage and members of the Senate Public Health Committee for allowing me the opportunity to testify in favor and support of SB 88. My name is Jamie Gideon, and I'm the Kansas Director of Public Policy for the Alzheimer's Association. As Haley mentioned, the ombudsman's, one of their jobs is to investigate complaints by residents or their families that are in a long-term care setting. If that resident has dementia, it would only benefit the resident's family, the nursing home, long-term care ombudsman themselves, if the ombudsman's office has the proper training to communicate with that resident and understand the behaviors of those with the disease. There's a true need for this type of training, and it's only increasing. 65% of nursing home residents have some type of cognitive impairment. Couple that with the fact that the number of those living with Alzheimer's is due to increase by 41% by 2050. In addition, there's no cost for this training. Resources for training can be found through the Alzheimer's Association and through the National Long-Term Care Ombudsman Resource Center. The Kansas State Legislature should act now to help the long-term care ombudsman staff serve residents in long-term care settings. It is important to do everything we can to protect the most vulnerable in our community, including those living with Alzheimer's, and those should be protected. I will stand at the appropriate time for questions.
Thank you. Next, we have Tiffany Nacardo. No, Nacarado.
Madam Chair Gossage and members of the State Senate Public Health Committee, my name is Tiffany Nacarado, Doctor of Nursing Practice and lifelong Kansan, proudly serving rural Kansas as a nurse practitioner for the last 15 years. I am here today as a proponent of Senate Bill 88, requiring dementia training for the State Long-Term Care Ombudsman Office. As I began my career in healthcare, my mother was diagnosed with early onset Alzheimer's disease. She was a mere 56 years old. My father selflessly cared for her at home until his own health began to decline, and ultimately we lost him 3 years ago. You see, one way or another, Alzheimer's disease has robbed me of both of my parents. As my family navigated the complexities of caregiving, we were faced with the harsh reality of limited resources and support. Ultimately, we made the difficult decision to transition my mother to a long-term care facility, where she has resided for the last 3 years. Despite the challenges, she is now thriving in a safe and supportive environment. As a caregiver and a healthcare professional, I've witnessed firsthand the devastating impact of dementia on families and communities. That's why I'm passionate about ensuring our long-term care facilities provide the highest quality of care possible. The alarming reality is that over 65% of long-term care residents live with dementia, yet those advocating for their rights and well-being lack formal dementia training. This bill isn't about creating new infrastructure or allocating additional funds. It's just about doing the right thing. The training exists, and there's no fiscal note attached. So by supporting Senate Bill 88, we can raise the bar for care and compassion in our long-term care facilities. As my father used to say, it costs nothing to do the right thing. I urge all of you to do just that and support Senate Bill 88. Let's stand together for my mother, for the tens of thousands of Kansans living with dementia, and for those yet to be diagnosed. Thank you for your time and attention.
Thank you. And next we go to Ruth Burris, and a private citizen should be virtual. Can you hear us, Ruth?
Yes, I can hear you.
Please go ahead. You have 2 minutes.
Madam Chair Gossage and members of the Senate Public Health Committee, my name is Ruth Burris, and I'm testifying as a proponent of SB 88, requiring dementia training for the State Long-Term Care Ombudsman Office. I've had Alzheimer's in my family for the last 40 years, and currently my sister-in-law has recently been diagnosed with early onset Alzheimer's and is a resident of a long-term care facility. She is 58 and has been a resident for the past 2 years. She is still very active and healthy, but has no short-term memory and is unable to do things for herself, such as dressing appropriately and taking care of personal hygiene. Sometimes her needs aren't taken care of because she appears to be very capable of caring for herself. Alzheimer's can often be misunderstood if there is no training regarding how to deal with the unique challenges presented by an Alzheimer's or dementia diagnosis. Additional dementia-specific training regarding Alzheimer's and other dementias for the State Long-Term Care Ombudsman Office would help with the understanding of the challenges that Alzheimer's and other dementias present. I urge the committee to support SB 88. If you have additional questions, I will stand for them at the appropriate time. Thank you for this opportunity.
Thank you for being with us. Lori Beck is also on virtual. Can you hear us, Lori?
Yes, I can.
Please go ahead. 2 minutes.
Right. So, Madam Chair and members of the committee, my name is Lori Beck, and I'm testifying as a proponent of Senate Bill 88 requiring dementia training for the State Long-Term Ombudsman's Office. As a former caregiver for my mom who had Alzheimer's disease and currently a volunteer community educator with the association, I believe I can speak to the need that would require the Ombudsman staff and volunteers receive training that would ensure the health, safety, welfare, and rights of residents living in long-term care facilities. As you heard, the Long-Term Care Ombudsman supports the bill, and there is no fiscal note attached to this bill. So as the staff and the volunteers with the Ombudsman's office investigate complaints, it's vital that they have the skills, the knowledge, and the ability to determine if the complaint has merit, and that they know ways to help residents and their families deal with issues such as communicating effectively with those with Alzheimer's or recognizing behavioral symptoms, addressing specific aspects of safety such as wandering, aggression, confusion, suspicion. As a community educator, I've taught all of these classes to businesses and nonprofit organizations and those simply interested in learning more about Alzheimer's disease. I retired 10 years early so I could care for Mom in my home, which I did for nearly 5 years before her behaviors changed due to Alzheimer's disease. My sister and I placed Mom in an assisted living memory care facility where staff received training on how to deal with residents with Alzheimer's disease. Staff were well versed on how to keep the residents calm, engaged, safe, and they treated the residents with the love and respect due our seniors. Our long-term care ombudsman staff and volunteers should be equally educated and trained. I urge you to support Senate Bill 88. Thank you for your time, and I'm happy to stand for questions at the appropriate time.
Thank you so much. Committee, do we have questions of our proponents? Senator Hulscher.
Thank you, Madam Chair. I have a couple questions for Haley. My first question is, your testimony outlines that there's already federally required training of 36 hours. Can you tell me your understanding of what the difference would be or enhancements from the training that is being asked for in this bill?
Yes, thank you so much. Excuse me for asking that, because that is exactly where I was attempting to head. So I appreciate that. Okay, so I added into my testimony documentation for you all that is from the ACL. So the Administration for Community Living is who oversees a lot of that. And if you will look with me, I believe in the packet it is page 3 that is listed. That is where it starts the training standards for our designation. And it goes through the different hours listed there, but it also continues on. And on page 4, it does list that part of the training is the resident and the resident experience. So part 2, section A states towards the end of that paragraph, developmental, intellectual disabilities, Alzheimer's disease, and related dementias. Underneath that, it goes and talks about the resident experience of living there, myths and stereotypes, long-term care settings, overview. And number 3 talks about resident rights and person-centered care. So this all does encompass it. So we are required already to have Alzheimer's and dementia training. And it goes on to page 6. Section 8 lists common resources and agencies. And that does list in there dementia specialists and others as identified by the state long-term care ombudsman. So that includes the referral portion of it that's already discussed. And then below that, the learning objectives of what this training encompasses and what we stand to learn from that. Number 4 states the resident rights and choices that are paramount to the program, promotes the empowerment and the person-directedness. And then number 6 on page 7 covers the awareness of the different communication styles and strategies to communicate. So a lot of this language is already included in what is relevant for us. It's already included in what we are required to receive. Our biggest concern with this, again, we support dementia training. We support this because obviously we are already doing this. Our biggest concern with this is that the wording of the language, and you can see that in my written testimony, is that the subsections that specifically list out all of the requirements of shall include, it's a great list relevant to providers. And that was why I really started my testimony with describing the differences because, for example, like wandering, if we had a resident wandering, we could not intervene. That's not something we can do because we don't provide the care. We would, seek that assistance, but it's not relevant to enforcing resident rights for us. Our stance would possibly even be coming in and saying, what can safe wandering look like? Because they have a right to wander. So I wanted to focus on that. So we're really looking at the appropriate language.
Thank you, that helps.
Thank you.
Committee, additional questions for any of the proponents? Senator Petty.
Thank you, Madam Chair. And I'm taking it as a follow-up of what you just said, that that it appears that just number 3 is needed, or you're suggesting number 3 on page 2 and not the subsequent letters A through G that follow.
Yes, exactly. That is our recommendation, that it would be just subsection 3 and not the additional for that, because every time we take a stance of looking at something, it has to come back to how does this apply to resident rights? Like we have cute little mugs I could bring you all. Is our primary focus of what does the resident want, because it is about the resident rights. And we want to make sure, especially with a dementia diagnosis, what we run into a lot of times is it sadly seems as if once someone is labeled with a dementia diagnosis, it's almost as if they lose all rights. It's almost as if they lose their personhood, their sense of identity, their personal preferences. And so that's what we come in to enforce. And so by changing that language, it would make it more resident rights focused, and it would allow us the opportunity to change that training as the resident requirements, as the resident needs, adapt and change with it also.
Thank you.
Senator Blasey.
Thank you, Madam Chair. I was just curious, since the ombudsman wasn't able to get that in the testimony, if we could get the Alzheimer's Association, Jamie, up here to maybe share her thoughts on those recommendations, just to get a full perspective, if that's okay. Thank you.
Thank you, committee. Sorry, a little shorter. The reason why, a few things, the reason why some of those topics were included is because there's a difference in being actively involved, meaning you can't push someone in a wheelchair, for example, and being educated on the topic. So wandering was mentioned. It's a difference between, yes, you're not going to be able to respond to a wandering call, but you need to know what wandering is. If you hear about, oh, that person had been actively wandering in the past, well, what is that? Yes, you're not going to be jumping in the middle of that, but you need to know they have a history of it. So you have that idea. You need to have the education in your background of each of these topics. A lot of it's the communication topics. None of these are listed in their training in the state, none of them at all. From what I've been told, that they hadn't been doing this training in the past. And so it depends on the particular long-term care ombudsman's office, what training they institute, if it's not in the state statute. So if the topics are in there, then they're able to include that in the training, and they have to go over that with their regular yearly training.
Jamie, while you're at the mic, could you just clarify, in my office when we were talking about this, there were a couple of things. One, the reason there's no fiscal note is that the Alzheimer's Association is going to be providing this training at no cost, correct?
Yes, that's true.
The reason that you did, that you're asking for us to put this in statute, because you could have provided the training and it didn't require legislation to be able to do that. But as you mentioned to me, there could be a different ombudsman later, and you just wanted to make sure that they always have this training. Is that accurate?
But it's always in there, yes.
Is there anything else you would like to add?
No, that's it.
All right, committee, any other questions? Seeing none, thank you so much, everyone. And this closes the hearing on Senate Bill 88. We will now open for final action Senate Bill number 29. And I would like to begin with a substitute bill amendment. And Jenna will be passing that out now. Just for a little background, committee, Senate Bill 29 that we heard was the original bill that came to the committee. And it was heavily amended on the Senate side, not only in committee, but also on the Senate floor. So what this substitute, that's all right. we'll get it together here. So what the substitute bill, Senate Bill 29 does is it just focuses the attention on one portion of that piece of legislation, which is dealing with public gatherings. And we heard a lot during COVID that people couldn't go to church or they couldn't gather in other facilities, and they felt the schools had to close. They felt like this was an overreach. So what this simply does is that they, the county or the joint board of health or local health officer may recommend against public gatherings, but they cannot require or are not empowered or authorized to prohibit them. That is what the substitute for Senate Bill 29 is, and then we will open that up for discussion. Yes.
Jenna Moyer, Advisor
you, Jenna.
Statutes Office. I will just note that this is Section 5 of Senate Bill 29, exactly as it was in the bill.
Any discussion or questions? Senator Holscher.
This one might be for Jenna. So if I'm understanding correctly, it affects rules in terms of gatherings, but does that also affect then quarantining or isolating overall?
Thank you, Madam Chair. No, this would not restrict the current authorities related to isolation and quarantine.
Senator Petty.
Madam Chair, don't we usually have a review of the bill before, by the revisor before we work the bill? Or am I not remembering that?
We could have, but this is a substitute for Senate Bill 29. So, I mean, if you would like for her to review Senate Bill 29, we can do that. Would you like for her to do that?
Okay, so this is a proposed substitute for the full bill.
Yes,
Full bill.
it is. Any other questions? Senator Murphy.
Well, thank you, Madam Chair. Yeah, disappointment, as we've discussed. This indicates that there's an issue with infringing on rights. And so we're determining that there's times when we can infringe on rights, there's times when we're not. And I think constitutionally, there's no time we can. I also understand the situation we're in. It's just, we've got a history. When we look at the COVID deal, there was a lot of actions taken, and they were 100% wrong. And there's nothing in here that's going to prevent that from happening again. And I think back, I was reading, I like to read a lot of history, and I was reading a story about a young girl that was 12 years old that was taken into custody for 3.5 years. And her crime was being Japanese. Fear is a huge motivating factor. And so when people get afraid, those in charge do things that maybe they should not do, and those who are out there watching and wandering and everything like that get afraid and do things that maybe they should not do. But I just wanted to voice my opinion. Thank you.
Thank you, Senator Murphy. And I would say I realize this doesn't go as far as some people would like for it to, but it does protect the rights of people to have public gatherings. Any other questions or discussion? Senator Holscher.
Since Ashley is here, could we ask her a question about the implications of this type of change and your thoughts on how it could endanger public health? We've had, prior to COVID, decades of public health efforts that have been very successful in containing diseases. Would you care to elaborate?
Ashley, you may come to the mic.
Thank you. Ashley Goss, Deputy Secretary for Public Health, KDHE. Senator Holscher, I need to probably study this amendment more, but I will say in public health years, which goes back well over 100 years for public health, in regard to stopping the spread of disease, quarantine and isolation has played a major factor in that. And from what I understand from the chair, that doesn't affect this. We still would be able to isolate and quarantine to stop the spread of disease. And so I appreciate that still being in there. I just the piece I need to understand more on if the local health officers and the Board of County Commission, which is the Board of Health, would still have the ability to recommend, okay, here's what's happening in this part of the community, we would suggest, or is is this taking that completely away is what I'm trying to understand.
And Jenna, correct me if I'm wrong, but the way the bill reads is they may recommend against public gatherings.
Thank you, Madam Chair. Yes, the county or joint board of health or local health officer may recommend against public gatherings, and this would be a change from the current law that would allow those officers to prohibit public gatherings.
Okay, thank you.
Thank you.
Janet, can I add more to that, Senator?
Yes, please.
So to answer Senator Holscher's question, so being able to recommend is good, but if it comes to a point to where they cannot say, please don't gather here, it can be a problem. Like, none of us have ever lived through a pandemic before. We weren't alive, for the Spanish flu. So this was new. So I think having some ability is good. Of course, my preference is to be able to keep it, but it could work.
Thank you so much. Committee, additional questions? Senator Erickson.
Thank you, Madam Chair, and this may be for Jenna. Jenna, can you just clarify for me the difference between quarantine, isolate, and public gathering? Could a health official isolate or quarantine mass groups of people? Can you just clarify that distinction? Thank you.
Thank you, Madam Chair. And I may need a little technical assistance from the Secretary, but I believe that in order to isolate or quarantine individuals, there has to be an order or direct, interaction, knowledge of those specific cases. I'm not aware of the authority to just say everyone who lives in Topeka is quarantined. So I think it would have to apply to specific individuals that have a known either infectious or contagious disease or exposure.
Senator Clifford.
Yes, thank you, Madam Chair. I'd just like to follow up Senator Murphy's remarks and remind everyone in the Kansas Bill of Rights, subsection 3, the right of peaceable assembly and petition. The people have the right to assemble in a peaceable manner. Thank you, Madam Chair.
Senator Thompson.
Thank you, Madam Chair. And I've long, since the COVID debate, thought that we needed to amend the emergency management statutes even more. We did a little bit during COVID when it was fresh in mind. But to Senator Murphy's point, golly, our constitutional rights were just absolutely stepped on. I think this is a good first step. I think, we need to give people, particularly with the news media and the availability of social media, and to get information out these days about, what a disease can do, then everybody makes their own decision with regard to masking, with regard to public gatherings, whether they want to stay home or not. But I think the recommendation I felt during COVID was a strong enough step that people could make their own decisions. Do they want to take those steps to gather or not? And we saw that in churches, and to have government or a governor unilaterally make those decisions, I felt was just an overreach. So, guaranteeing people rights to listen to, what we know, and we know a lot of what happened in COVID was wrong now, is a good step. So I'll support this bill. Thank you, Madam Chair.
Senator Murphy.
Well, thank you, Madam Chair. I was just, as Senator Thompson was speaking, I was thinking that, during the response to COVID, which of course is what brings a lot of this, fresh to mind, is Sweden actually didn't do anything. They did kind of what we're talking about. They told everybody, say, hey, this is going around. Everybody be careful, avoid whatever. Restaurants stayed open. People went to the theaters stayed open, everything. And in retrospect, you look back and see they actually had fewer deaths and fewer problems than everybody else. So once again, we reacted 100% wrong. And it just bothers me that we still leave that, but I understand. Thank you.
Senator Petty, and then we'll vote.
Thank you. And I want to say that it's unfortunate that we cannot move on past COVID. And I want to thank the Department of Health and Environment and the governor and our for taking the measures that were important and for the fact that we were able to come up with a vaccine that did help to save lives. When 1 million people died in Kansas because of COVID, and we don't want to look at what's happened across the United States of America and admit that there was a contagious disease that was addressed, and that we've been able to move on from that. So it's kind of like saying that won't be measles again. We know that this will happen again, and we need to have those things in place that will keep us all safe. We can make choices whether we want to wear a mask. We can make choices whether I want to use this hand sanitizer to keep you from catching my cold. But those are choices that we can make, and we know better about how to address it. I want to say that when we were dealing with COVID and people were wearing masks, there was a lot more healthy people around here because we were not spreading that disease. So I want to thank the Department of Health and Environment, and I think it's terrible that we continue to debase what we've done for public safety in the state of Kansas over time.
Committee, I will now move to adopt the Senate bill. Do I hear a second? Or excuse me, substitute to Senate Bill 29. Do I have a second? Senator Thomas. Committee, all in favor, say aye. Aye. Opposed? The ayes have it. Substitute for Senate Bill 29. I'm sorry. Exactly. Thank you. And so we adopted the substitute for Senate Bill 29, and I need to say I move the committee pass substitute for Senate Bill 29 favorably for passage. Do I have a second? Senator Thomas, all in favor say aye. Aye. Opposed? No. It has passed. And now we were moving to final action on Senate Bill 126. And I believe we have an amendment. And Jenna, if you could give us a quick review while someone else is passing out those amendments for you.
Thanks, Madam Chair. Senate Bill 126 is the Physician Assistant Licensure Compact that we heard yesterday.
We just heard this yesterday. We also heard that perhaps a couple of technical amendments might be in order. And Senator Clifford, if you would just tell us about the balloon amendments that you have for us.
Thank you, Madam Chair. I'll call your attention to the third page of the amendment package. It's page 3, though, in the original bill, line 38, if you have the bill open. We had some recommendations by Will from the Chamber of Commerce, William Wilk, sorry. And it just changes those words in line 38, section 3A5. Again, page 3, line 38. Currently reads fully implemented clinical background check requirement within a time frame established by commission rule examination the results. It is changed to the words you see, which would say by its licensing board receiving the results of a criminal background check.
And Jenna, there's one other technical portion of this balloon. Can we just go ahead and do that one as well?
Yes, I believe it changes the word contract to compact, which was a technical.
Just a technical change.
Typographical error, yeah.
All right. Committee, any questions or comments about this technical change? Senator Petty.
Thank you to Senator Clifford for bringing this forward. I know from our past experience of dealing with compacts that it's important that we mirror what's already been put out across other states. So appreciate these amendments.
Correct. Thank you. Any other comments or questions? Senator Clifford, are you prepared to move your amendment?
Madam Chair, I move my amendment.
Do I have a second? Second by Senator Blasey. Any other discussion? All in favor say aye.
Aye.
Opposed, no. Senate Bill 126, we have the amendment has been passed, and now we need to pass the bill itself. Senator Blasey.
Madam Chair, I move we pass out Senate Bill 126 as amended favorably for passage.
Do I have a second?
Second.
Senator Clifford, all in favor say aye.
Aye.
Opposed? The bill has passed, and committee, we are adjourned.
Look at that, 9:20.